clinical anatomy of pharyngeal wall. Now, before we start with this topic, let us understand one thing. Success is a journey. It is not just a destination. Throughout your career, you all guys will be studying and every day, day in and day out, okay? But you have to enjoy that. Every day, you will gain some knowledge. You will achieve something. Start enjoying it. Start enjoying this journey. Then every day will become happy. You will be happy. Your goals will be easily achievable. Okay, so just don't think that you are preparing for one exam and that is going to be the end point and after that only you will have success. No, every day is a success. Every day you do achieve something, you do something, right? Okay, so let us start with the first topic in the pharynx, that is, the clinical anatomy of pharyngeal wall. But before we go that, let's look at this diagram. We're talking about the pharynx. Now the pharynx, it is an inverted cone shape, inverted pyramid. Okay, it starts, you see, from the skull base over here and goes up till over here, where lower end of cricoid cartilage. Okay, what starts just below the lower end of cricoid cartilage? We have over here the esophagus. Right? So the esophagus starts over here at the lower end of cricoid cartilage. All right. So from the skull base to the esophagus, we have this pharynx. It's like an inverted cone. Right? Okay. Let's look in this diagram. What do we see in this diagram? You see, this pharynx is a cavity. It's a common pathway for food and your airway. Right? So the air goes from the nasal cavity over here. Right? It goes from the nasal cavity over here and it goes from the pharynx into the larynx. And the food, on the other hand, is going from the oral cavity into the esophagus, again through the pharynx. So it's a common pathway, right, where both of them are passing through. This starts again, as I told you, at the skull base and goes till the lower end of cricoid cartilage. Now, we can divide this pharynx into three parts. You see, from skull base to hard palate and behind the nasal cavity, we have the nasopharynx. It is the uppermost part of the pharynx, so it is also known as epipharynx. Now, from hard palate, you can see over here that this is the hyoid bone, and between them, behind the oral cavity, we have the oropharynx, right? And then from hyoid bone to the lower end of cricoid cartilage, you see this part, the blue colored part, it is behind and around the larynx. Not just behind, but also on the sides. So it is known as hypopharynx, lowermost part, or laryngopharynx, right? So what are the three parts? Number one, nasopharynx, also known as epipharynx. Number two, oropharynx. And number three, hypopharynx or laryngopharynx. Right? Now, before we discuss each of these parts, their anatomy, their diseases, let us first look at the pharyngeal wall. So, how many layers are there in this pharyngeal wall? You see, we can see the skull base, we can see the eustachian tube coming from out to in, and we can see the four different layers. Now, these layers, they can be studied from in to out. Okay, what is inside? Inside is pharynx, pharyngeal cavity. We're going out. Okay, so when we are going out, so from pharynx to out, now number one, the innermost layer is the mucous membrane, the mucosa. Now you'll ask, sir, what is this mucosa? So you see, this mucosa is pseudo-stratified ciliated columnar epithelium. Okay, right? So we know that this is the pathway of respiration. So obviously, we have the respiratory epithelium, that is the pseudo-stratified ciliated columnar epithelium. But this epithelium is majorly limited to what we call as nasopharynx. Okay. Now, in the oropharynx or the hypopharynx, This is replaced by stratified squamous epithelium. So somebody asked a question, sir, we have tonsils. Which tonsils? Palatine tonsils. So this question comes in the exam. The palatine tonsils, where are they present? We will be studying them soon. They are present in oropharynx. So the medial surface of these palatine tonsils, what epithelium do they have? So yes, they have your stratified squamous epithelium. Now, whenever somebody asks you whether it is keratinizing or non-keratinizing, just remember that outside on the skin, whenever we have this stratified squamous epithelium, that's a keratinizing epithelium. But in the mucosa, inside the cavities, if we have stratified squamous epithelium, that is a non-keratinizing stratified squamous epithelium. Right? Okay. So, mucosa is pseudostratified slated columnar epithelium in the nasopharynx and non-keratinizing stratified squamous epithelium in the oropharynx and major part of hypopharynx. Right? Okay. Now, what is the second layer? So, second layer is near the pharynx. So, the pharynx word comes first over here. This is pharyngobasilar fascia. See, the pharynx word comes early. Okay, so we are going from pharynx in to out. Out, you can say, is the base. Okay, so we are going out. So into out, so into base. So pharyngobasilar fascia. The B comes later. Right? The B comes later. And the third layer is the muscular coat, the muscular layer. This is the most important layer over here in the pharynx, and therefore I will be discussing this in detail. And the outermost layer is another fascia that is away from pharynx. It is near the base. So you see the B comes earlier. So we have buccopharyngeal fascia. You see the pharynx now comes late. So buccopharyngeal fascia. Right? Okay. So we have seen the 4 layers of pharyngeal wall, the mucosa or the mucous membrane. Number 2 is the pharyngobasilar fascia. Number 3 is the muscular coat. And number 4 is the buccopharyngeal fascia. Right? So as I told you that the muscular coat I will be discussing in detail. So let's look in this photograph. What do we see? Now, before I explain this photograph to you, just remember that this muscular coat, it consists of 2 layers of muscles. Okay, 2 layers of muscles. Number 1 is the outer layer. Okay, this consists of constrictor muscles. Right? Number 2 is the inner layer. So we'll be discussing both the layers. The constrictor muscles are somewhat like circular muscles. Okay, they constrict the pharynx. Okay, and the inner layer is somewhat like longitudinal muscles. So they pull up and down the pharynx, and both these activities, they help us in passing the food down. They help in digestion, in swallowing activity. Okay, right? So 2 layers of muscle, outer layer and inner layer. So let us first look at the outer layer of the muscles. So what do we have in the outer layer? As I told you, we have 3 constrictor muscles, right? All these 3 constrictor muscles, they start anteriorly from some structure. So they are attached to something anteriorly. They go around the pharynx, and you see they fuse with each other in the posterior midline raphe. So you can see over here, that's the raphe being seen on the posterior part, where the 2 constrictor muscles of each side, they are coming and fusing with each other. So what is the first constrictor muscle? We have the superior constrictor muscle. Right? So first is the superior constrictor muscle. You can see over here, it is starting from the pterygoid process. Right? You can see over here, there is pterygomandibular raphe. Okay, it also arises from soft palate. Obviously, we are not showing any soft tissue to you, so you cannot see it. It arises from the soft plate as well. And then you can see it is going and fusing posteriorly with the other side. Then we have the middle constrictor muscle. The middle constrictor, as you can see, it is rising from the hyoid bone. Okay, and the inferior constrictor also can be seen over here. The inferior constrictor, as you see over here, it is arising from thyroid cartilage as well as from cricoid cartilage, right? Okay, so we can see that the inferior constrictor muscle is arising from two different cartilages, thyroid and cricoid cartilage. So therefore, this inferior constrictor muscle has two different parts. They are known as thyropharyngeus and cricopharyngeus. Okay, so there are two different parts, thyropharyngeus and cricopharyngeus.